My name is Dr. Brooke Laurent. I'm an osteopathic family medicine physician. I serve as the executive director for the Delta Population Health Institute. DPHI is committed to capacity building in our communities. This means we convene leaders that are connected to education, community development, economic development, food system, and more. We convene them, bring them to the table, and invite them to envision a community of health and how they, in each of their sectors, can create policy, system, and environment change that will achieve health equity and to address health disparities. We empower community champions for them to get understanding of health and how it impacts their community, and ask them to spread and share the information so that they too can be leaders in their community. They're more powerful than the words and education and pamphlets that we're going to offer people. So tap into the lived experiences. Be mindful of your own lived experiences. That's the starting place to navigate that. And then begin to see how that lived experience is informing health, how that lived experience is telling them what options they think they may have.
I am the Regional Program Director for Delta Population Health Institute, and I serve as the Program Manager for the Community Champions of Health initiative. This initiative will establish sustainable programs that will improve health behaviors and health outcomes through policy, system, and environment change. Our community leaders will be able to cast a vision of health for their communities and successfully implement it.
A vision of health for my community would be that everyone is treated equal, that everyone has the same access to all things in our community.
I think my role as a community and champion of health for my community is very important because I'm able to have access to different resources that helps increase my knowledge, and I'm able to serve as a liaison to communicate those things.
My life work impacted my community by me going to the schools. I'm a mentor, and I love to pour into our children because they are our future.
I feel like as a community champion, I can lead individuals to become more knowledgeable about their surroundings and their health.
It's important for me to be a voice for my community, for people who feel like they don't have a voice, who don't know that their opinions matter when it comes to their community.
I think El Centro Hispano's partnership with DPHI support us in educating our community and having a more preventive approach to healthcare.
Well, my name is Christine Hartford. I am a physician and I'm the medical lead for our Delta Caravan community outreach events. It has been a real privilege to be a part of this work. I think when we're going out to the underserved communities in the Delta, we are really trying to provide services that people who live there have difficulty accessing.
Under research, we are committed to using principles for community participatory research to ensure that any information that we gather from our patients and our community members belong to them, so that they are empowered to create the policy, system, and environment changes that are needed for them to achieve the vision of health for their community.